I'm Marvin Plackett, and today is Wednesday, June 10th. Greetings to all residents, to all staff, and to all guests. Incidentally, yesterday I do realize, because a number of you let me know, thank you very much, that the camera was pointed over there. And that was an accident. We have figured out what the problem is, so all is good from now on. Channel 6.1. Today we received confirmation, in fact it was late last night, that we have our first confirmed COVID case at the Gardens. Matilda House, 5th floor. That person has been transferred to our dedicated COVID unit at Episcopal Church Home, where we have our other active cases of COVID at our dedicated COVID unit, 2nd floor, Episcopal Church Home. So this is our first case though at the Gardens, and of course we've been living with on our campus at Episcopal Homes with COVID for 5 or 6 weeks now. But anytime a new community receives their first COVID case, it's a bit unsettling, it's a bit jarring, and of course immediately a number of steps get put in place. Like for instance, immediately all staff must wear the full protective gear, the PPE, personal protective equipment, and that person of course is isolated. But at the Gardens we have all private rooms, all private bathrooms, so all the residents are pretty much isolated at all times anyway. And then of course there's immediate contact tracing and testing for all those that are on the Matilda House unit or in the Matilda House, all residents, all staff that have come in contact with this person. And then you go from there to do the contact tracing and then the testing. So all that is occurring, and at the same time making sure that we promptly communicate to all interested parties. So all residents at the Gardens, all resident families, and all staff. And that occurred this morning or somewhere around the middle of the day. So this is part of our communication to you, being fully transparent about where we stand with COVID at this time. No other confirmed cases except the one that I just talked about. So that means that as of right now, we have 19 active COVID cases. 9 are residents and 10 are staff. And those 9 residents are now located at Episcopal Church Home, our dedicated unit, and all those staff, of course, they are home recovering and won't be rescheduled until they are entirely cleared and free of COVID. Where do we stand with some of our statistics? Yesterday, you may have gone to the link. There was a article in the Star Tribune highlighting some newly disclosed information about nursing homes in Minnesota. And I went to the link, and as of a few days ago, we are listed, of course, because we have active cases at Episcopal Homes. And there's multiple pages, very fine print. Maybe there's over 300 facilities that are mentioned here. And at the top of the list, the organization that has the highest count to date, they had 295. If you go down 65 spots, so in 66th place in terms of total case count, that's where Episcopal Homes is. And as of just a few days ago, we had 20. And as I mentioned, we right now have 19 active cases. But as of a few days ago, at that time, we had 20. So we feel pretty good about how careful we have been and how much we have controlled COVID on our campus. Dr. McDonald, he is our medical director at Episcopal Church Home and at Iris Park Commons. Yesterday on a group Zoom meeting, he was very complimentary because, of course, as we know, a number of organizations, long-term care facilities, when they've gotten a case, it has spread quickly throughout the facility, and that has not happened at Episcopal Homes. We have had some spread, yes, but we have largely contained it. And he complimented us highly for the infection control techniques and the practices that we have in place for controlling it. And he said this, he said, remember, with your solid practices, with your diligence, you are saving lives. Remember, all of us are playing a role in saving lives. Yes, that's how serious it is. That's the power of what we are doing. the maintaining social distancing whenever possible, wearing our masks, frequent hand washing, following infection control procedures, all those things put together, those are the things that save lives. I want you to know that I mentioned this once before, I want you to mention it again. Yesterday we had a board meeting, and I just want all of you residents and staff and family members, guests, I want you to know that the board of trustees that we have at Episcopal Homes, they are really actively engaged. One way or another, I am interacting with at least one board member every day. And I'm giving updates to the board members at minimum once a week. And we have now monthly board meetings ever since COVID has come in place. Prior to COVID, we had quarterly board meetings. My point is this, the board members are really actively engaged. They care. They really want to know, how are we performing? What are we doing to protect our residents? What are we doing to live our mission of helping our residents to fully enrich their lives and build community at Episcopal Homes? The board members really care, are really involved. They're paying attention. They're asking all the good questions. So know that they are there as well. It isn't just me as CEO and then our leadership, the rest of our management staff, and the other 480 staff. It also starts right at the top with the Board of Trustees, really impressive group. As you should have read by now, there was a document that came out 2 days ago about the gradual reopening of our Episcopal Homes communities for the independent living communities. And so if you haven't yet read that, be sure to read that. And you'll find it, of course, it's in various places in each of the independent living communities. For Episcopal Church Home and the Gardens and Iris Park Commons, our assisted living facility, for those three communities, we have to live by the rules as outlined by the health department that pertain to long-term care. And so the requirements are definitely stricter there because those that live in nursing homes and assisted living are more frail. So it requires more careful procedures. And so that's why we have sort of the dual processes at Episcopal Homes. Just remember how important it is that you always apply the diligent practices that I've already talked about. Look forward to seeing you tomorrow at 1:30. And now for some final words, I'm pleased to introduce our Chief Operating Officer. Many of you know him, Steve Mork. Steve has been with us for the last several years. Steve plays a really vital role in being the person that is over in particular, our two nursing home administrators, and then several of our other operations here at Episcopal Homes. Very diligent person. Pleased to introduce Steve.
Good afternoon. Thank you, Marvin, for the introduction, so I don't need to go and tell you anything about myself and what I do. So I'm just going to tell you about my grandpa. My grandpa lived to be 104. He was a farmer who lived in a place called Comfort Valley. Born at the turn of the last century, not this one, he lived through 100 years of wars, droughts, the economic crisis, diseases. He saw people fly to the moon, although he started his life in a horse and buggy. He more than once told me that life wasn't always so comfortable in Comfort Valley. In recent months, we've been reminded that life isn't always easy or comfortable. The virus, the slowing down of the economy, and the reawakening of society's racism has placed new challenges before us. Thankfully, like Grandpa's Comfort Valley, we have a strong community at Episcopal Homes. We have a diversity of ages, of histories, of cultures, of traditions, but we have a single mission to provide dignity to our elders, to our staff, through respect, listening, empowering, and appreciating each other. We have a great team, a team that addresses a wide range of infection control measures, staff education needs, and resident life issues. And even with these efforts, as Marvin noted earlier, says keeping the virus out will be an ongoing challenge for us. Nevertheless, our community in the middle of St. Paul has adapted to be a safer place. Together we have been able to be comparatively successful in keeping the virus at bay. Not out, but not overwhelming us. So today is my opportunity to say thank you. Thank you to the volunteers, the donors, the families who have equipped us with face masks and shields, who have donated money for new equipment, iPads, virtual visits, and found ways to bring joy to our community and to creatively say thank you and support our staff. Thank you to our dedicated staff who work hard every day to put their fears aside and to put all the donations that we've received to use to enrich the lives of those we serve. Thank you to our leadership team and board that is committed to an introspection focused on illuminating where our own practices may reflect the racism in our society. And thank you to the families who have trusted us during these times of separation. Beginning now and into the future, you'll see our operations team beginning to reopen different programs and services. As we do, we are leaning heavily on the experts at the CDC, the Department of Health, and our medical director. With your help, we will do our best to safely provide opportunities for social interaction and the support that people need and want. Opening up may not always be comfortable, but with your help, we can do it safely. And with that, I say thank you, and when you're here on campus, we will wear our masks to protect you, and you are yours to protect our elders. Thank you.